After surgery, when approximately can I get back to my ineffective sit-ups?
Ineffective sit-ups. All right, so let's go over both of those. Typically, after body contouring surgery, let's just say it's a tummy tuck lipo. After about 10 to 14 days, most patients can go back to work in an office type setting. After about 3 weeks, we can begin low impact aerobics. And then we try to not really lift anything heavy or do anything rigorous for the first couple months. So that's sort of a schedule on the comeback from a tummy tuck lipo. But let's talk about ineffective sit-ups and what that actually means. And that's actually a really good question. So people will say, I do so many sit-ups and I can't get my stomach flat. You are right, you can't. Once it's stretched, it's stretched. And so your muscle is basically pulling two things together. And so it's attached up in your ribs and down your pelvis. And when you crunch, it pulls those two things together. If your wall is going outward like this and loose, then a lot of your muscle activity is actually just pulling it straight. And then from that point, you can crunch. And so you may lose 20, 40, 60, 80% of the effectiveness of the muscle just bringing it to straight, so then it can start to pull you together. And so one of the things the tummy tuck does is really tighten up that wall. And so when you go to do a crunch, your muscle fires and you regain all the function of the muscle. So you could have a very strong muscle, but it's ineffective prior to a tummy tuck. But that same muscle strength afterwards will work a lot better and have a lot more leverage to then allow you to do a crunch.